So we're going to be looking today, we'll be looking at designing implementation research, and we're going to adopt this outline, beginning with a review of implementation research, which is just a summary of all of what we've been learning for the past 2 weeks. Look at the characteristics of implementation research and the differences between IR and other types of research. Then we'll look at how we can formulate implementation research questions and the framework for formulating implementation research objectives. We look at the study designs and applications, and then we conclude. So our objective is that by the end of this lesson, you should be able to properly define implementation research and its unique characteristics. Also, you should know how to implement and use implementation research to implement an intervention to solve a public health problem. You should also be able to formulate clear implementation research questions and set appropriate outcomes and use appropriate study designs for your implementation research. So as we've earlier presented, we know that the main problem that exists is not the absence of interventions, but that we have interventions that are not able to reach the intended population or are not able to produce the expected results. So in this case, we have an efficacious intervention, and this intervention is intended to solve a particular health problem. But then in the course of implementing these interventions, there are problems, there are barriers to the effective implementation of this intervention to solve a particular health problem. Just like the example we saw previously, the use of mosquito-treated nets, how because of the lack of knowledge, because of the unavailability of the mosquito-treated nets, the people in that community were unable to properly use mosquito-treated nets. So again, we come with implementation research to be able to bridge the gap between implementing an efficacious intervention, which is similar to an EBI, and solving a significant health problem. So we look at implementation research as the study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine practice. So here we want to improve the quality and effectiveness of health services by identifying the barriers and facilitators that can either promote the implementation of our intervention or serve as a setback to our implementation of our intervention. So we're going to be using implementation research now to be able to know why this is not working, or even if it's working, how can we see how to improve on it, that's to scale it up, on how can we see how to make sure that it's used for the purpose for which it has been intended. So we have key characteristics of implementation research. The first is the fact that it focuses on real world setting. Again, we'll say that we cannot implement an intervention out of the context in which we want to implement it. The intervention has to be tailored to suit the particular context in which we find ourselves, taking into account other contextual factors like cultural aspects, socio-political aspects, and everything that can either be a hindrance or a facilitator to our intervention. We also centers around implementation strategies. Just like we earlier established, we cannot talk about implementation research without implementation strategies. What are the things that are going to make it easier for the intervention to be implemented? Do you have to educate them more about the use of the mosquito-treated nets? Do you have to send reminders on how to use the mosquito-treated net? All of these are implementation strategies, and they are very important when it comes to implementation research, because without the implementation strategies, you cannot effectively say that you're doing implementation research. And also, implementation research should involve the evaluation of the outcomes, not only clinical outcome, but also implementation outcome, just like we saw, the fidelity, the acceptability, the sustainability, and what have you. So looking at the characteristics of implementation research, we have the first aspect of it being systematic, in the sense that it follows a structured and methodological approach. First of all, you have to identify the problem in the community, because you cannot be conducting implementation research without knowing what is the problem, what exactly is the problem you want to solve, or what is the knowledge gap you want to bridge. So you have to be able to identify the problem and make sure that is ideally a problem of the community. You should analyze, and you also use implementation strategies to solve the problem. Also, implementation research is multidisciplinary. It cuts across different aspects. You have the health field, you have the social aspects, you have even the clinical aspects, and everybody plays a unique role in ensuring that the research is the intervention is being implemented in the way it's supposed to be. I would look at it being complex because of the fact that it's not a one size fits all, just like other research can be. So it's a little complex because you have to tailor your interventions to suit your local context at all times. And implementation research should also be contextual. You should be able to solve real world problems. You should be able to implement your intervention in a day-to-day life in a way that is not even if like writing the proposal and implementing it should not be two completely different things. You should write the proposal to suit the context in which you're going to be implementing your intervention. So it does not only talk about does it work, but it should also answer questions like how does it work, why does it work, and under which conditions are interventions going to be effective. So we have already established the fact that implementation research is systematic, is multidisciplinary, is contextual and complex. And we should not confuse it for it being a routine because implementation research is not a routine. It's not applied operational research. It's not a basic biomedical research where you want to discover a new drug or an etiological reason for why participants would prefer to take this drug or not. It's not a replication of an intervention, and it's not a routine progress report of a program. So sometimes when we're able to build on these characteristics of what implementation research is going to help us to easily differentiate between implementation research and other types of research, just like clinical research and operational research. So for us to be able to know the main difference between clinical research and operational research, we have to know what is the main focus. We know that clinical research will focus mostly on safety and efficacy of a health intervention. And operational research will focus on improving the health service or the logistics of a health intervention. Whereas implementation research will focus on integrating our evidence-based intervention into routine practice. So unlike clinical and operational research that have as outcomes clinical outcomes, implementation research has as outcome implementation outcomes. We're looking at the fidelity, the acceptability, the coverage, and what have you. And the primary question that is asked in clinical research is, does the intervention work under ideal condition? In operational research, the primary question is, how can we optimize health system performance? And in implementation research, we want to answer the question that how can we ensure that this intervention is delivered effectively in a real world setting. So once we have an understanding of how or what these different types of research is aimed at, we can be able to clearly differentiate between the clinical research, operational research, and implementation research. And talking about the methods, clinical research, you have mostly quantitative methods like randomized control trials. Operational research, you can have both quantitative and qualitative. That's can have a mixed method. And for implementation research, you can have qualitative and quantitative, and also the fact that you have to use frameworks. You cannot totally implement implementation research without the use of theories, models, and frameworks, just like we saw in our previous lesson. An example of a clinical research should be testing a new HIV drug in a trial, in randomized control trial. Whereas an operational research example can be studying the reasons for delayed ART initiation in rural clinics. And for implementation research, an example can be to assess the barriers and facilitators to HPV screening in a particular community. So all of these research types aim at answering a specific research question or meeting a specific need in the community. And sometimes it's also important to be able to incorporate or take into account the different factors or the different types of this research when you're implementing your intervention or when you're using an implementation research intervention. Also, we also have other types of research And for us to better understand the difference between implementation research and other types of research, we'll be using the example of the zinc deficiency and diarrhea. So the first part is we have used epidemiological research. We have built on the fact that zinc can be used to treating diarrhea in children. And this is how we are going to see the different types of researches using this example. Firstly, the epidemiological research is used to establish the association between zinc and diarrhea. This can be from literature or even from a survey that you do. And here, we are not focusing on the intervention, but we are mostly focusing on the population and not the intervention directly. And yet, the question that we want to answer is, what is the association of zinc deficiency with the severity of diarrhea in children? Then we have the efficacy research. Efficacy research in this case is talking about how we can increase the uptake of zinc in children that are suffering from diarrhea. So here is mostly focused on the intervention itself, because we want to be sure that the intervention works and how it works. I want to know that, okay, the children that need these zinc supplements are actually getting it. And then you have the program effectiveness research. The program effectiveness research focuses on how well a specific intervention or program works in promoting the use of the zinc treatment. And here the typical question you can be asking is, what is the effect of a program promoting zinc as an adjoint treatment for diarrhea? Is it positive or negative? And when we want to look at the implementation research of this example, we want to understand why the children are not getting zinc supplements. What are the barriers? What are the facilitators? And how can this be scaled up? If proven effective, how can it be scaled up to reach other population or children in different communities that may need it? And then moving on to the phase of research on an intervention, we have based on the fact that zinc can help treat childhood diarrhea. But how do we go from this knowledge to saving lives at this scale? That's where we have the first aspect, which is the pre-intervention stage, which is the epidemiological research. Here, this is based on literature, on the fact on literature. You have established the cause-effect relationship that, okay, zinc can treat diarrhea in children. And with this now, you want to understand the problem and the cause. Then secondly, we move to the efficacy research. And now we know that zinc can treat diarrhea, but under which conditions will zinc treat diarrhea? That's when you conduct your efficacy study. And now you want to test whether zinc will work under ideal conditions, like a clinical control trial or not. And if zinc has been proven effective in treating the diarrhea amongst children, then we can now move to the effectiveness study to see how much of how effective is the zinc treatment in children suffering from diarrhea. Then finally, now we go to the implementation study, the implementation research aspect of it. That's, you want to find out what are the conditions in which the program is effective, what are the barriers, what are the facilitators, and how can we improve or scale up the zinc treatment program to meet the needs of other children in different communities. So we see that in order for you to build on an intervention, you have to consider all of these phases of research, from the epidemiologic to the efficacy to the effectiveness and then the implementation. So what are the functions of implementation research? It helps us to identify the problem that can hinder the access to the intervention. And also, when we have identified the problems, it helps us to be able to tailor our intervention, or to tailor our strategies, our implementation strategies, to be able to suit the intervention that we are hoping to implement. Also, it helps in the developing and testing of practical solutions to these problems for a specific health system, an environment, and address a problem that is common to a particular region. Another function is the fact that it helps in identifying evidence-based interventions, tools, and services that can be modified to achieve a sustained health impact in real-world settings, including low and medium income countries. And also the fact that it provides the best way to introduce a practical solution in the health system, considering that we use frameworks which have been proven to be effective. And in the implementation of our research, we know that, okay, since we use theories and frameworks which have been proven to be effective, we can easily replicate this intervention in a similar setting. Now we're going to be looking at the phases of implementation research. We have three main phases: the pre-implementation, the implementation, and the post-implementation phase. For the pre-implementation phase, what do we need to do? First of all, we have to conduct a need assessment to understand the problem of the community. What is the main problem in that community, and how do we want to go about solving it? Then the second point is for you to be able to engage your stakeholders. And just like in the first lesson, we saw how to identify our stakeholders and at the different points in which we have to engage them, depending on their interests and what they have to offer. Also, you have to use frameworks to assess barriers and facilitators. That's a contextual assessment. Also, you should be able to adapt or tailor your intervention to suit your local context. Select the appropriate implementation strategies, and then develop an implementation plan. And also, for you to be able to evaluate the effectiveness of your intervention, it's good to have baseline data collected so that you know that you can actually measure you have moved from point A to point B, or the intervention was successful from point A to point B. Now, going forward to the implementation phase, the first thing you want to do is to pilot your intervention, because this helps you to be able to do the necessary amendment. If you see that maybe this strategy you wrote down will not be effective in this community, then you can modify the strategies and even modify your implementation plan. Then effectively roll out your intervention. It could be a new screening protocol, it could be a training package, it could be anything that you see that is tailored towards solving your problem, sorry. And then we have to execute the implementation strategies, which either provide training or reminders or audit feedback. And then you monitor for implementation outcomes. And if there have been challenges or problems that have been identified in the course of the implementation, you want to address these challenges and ensure that in the course of the implementation, you maintain engagement with all the stakeholders that were involved in the pre-implementation phase. And the post-implementation phase, basically, we want to evaluate the outcome of our intervention. So we're looking at outcome evaluation. We could use service evaluation or implementation outcomes as point of evaluation. You also want to talk about the sustainability of the program and how to scale up the program to expand it to other sites and other regions, and also talk about how to share your findings with stakeholders, with the funders, with communities, and even with the scientific community. So all of these categories of people will have different ways in which you can actually share your results with them. You cannot publish your paper and expect people in the community to have access to that information. So depending on who your target audience is, you should be able to tailor your dissemination strategies to suit the target audience. And as part of the outcome of the post-implementation phase, you want to do a translation, policy translation. That's using the information you have gotten from the program to be able to develop a policy draft where necessary. So designing an implementation research part, the first thing we have to do is a systematic analysis to identify our research problems. And also, as it means to identify our research problem, we want to have discussions with stakeholders. You also want to carry out routine and monitoring of health sector activities to discover where the challenge is or where the gap is. You can also have review meetings with major stakeholders to be able to identify your research problems. And once you've identified the problem, you define the problem and the magnitude of the problem. Then you can develop a conceptual framework. That's the use of the framework to be able to tell you, understand the barriers and facilitators to the intervention you want to implement, and also identify and develop implementation strategies for the intervention. And also this should be in line with our policies or in line with excuse me, priorities or recommendations that have been put in by the stakeholders, maybe in line with WHO recommendations, as for example. And you should be able to evaluate your implementation outcomes. You can either use a service outcome evaluation or implementation outcomes as evaluation, and also have a communication strategy to disseminate your findings, again, tailored to your particular audience. And these are some of the things that we need to be able to take into account when formulating an implementation research question. We should remember that our implementation research question will help us to guide us on the methods we are going to be using, and also the type of framework we are going to be using. So it's important that the question should be relevant, that should be of interest to policymakers, healthcare providers, program managers, and even the community in which you're planning to implement your intervention. It should be appropriate, that the question should be able to be answerable and realistic. The problem should be a reflection of the gap in the community, that should be problem-driven and also action-oriented. Identifying the source of the problem can help us to know how to act in solving the problem. So we should not come up with an implementation research question that cannot be solved. And it should be specific, it should have a precise focus and a well-defined target population. And the findings of our implementation research should be generalizable across similar settings and contexts. And also it should be innovative. So we're going to be using the PICOT framework in formulating our implementation research. And when we talk of PICOT framework, which is very, very similar to what we saw for operational research, just like in the previous modules, we talk about the population. So implementation research question should have a target population, it should have the intervention, it should have a comparison, an outcome measure, and a time period. So when we talk of the population, is who our intervention is targeting. Is it pregnant women? Is it children under 5? Is it policymakers? Who exactly is our intervention targeting? And the intervention in this case is the evidence-based intervention, what has been proven to be effective and what we want to implement in the community. And comparison, here we talk about what is existing and how the intervention is going to make the existing situation better off. And the outcome measure, you should be able to have the strategies measuring your outcomes in terms of percentages or other indicators. And also it should have time bound, it should have a particular period of time. It should not just be open. An example of an implementation research that contains all of these characteristics of the PICOT framework is amongst households in Mokolo, which is an area in Yaoundé. Does the distribution of ITNs through community health workers with health education compared to facility-based distribution alone increase regular use of ITN over a 6-month period? So we want to see if using community health workers and also using healthcare education, is it going to increase the rate at which community members in that particular area, that is Mokolo, are going to use ICN use compared to the existing strategy, which is that they go to the facility and collect their hospital net form. And this wants to be done, this observation wants to be done over a period of 6 months. So we have other examples of implementation research questions, like how do we improve the uptake of available prevention interventions by couples where one partner is HIV positive and the one is HIV negative? And also, what are the effects of tax shifting? That's shifting tax from one type of healthcare worker to another, such as from a doctor to a nurse or to the psychosocial agents. So what are its effects on prevention care and treatment service delivery, on quality, outcome, and cost effectiveness? So these are different implementation research questions. And if we have time after the lesson, we can go through to better understand. So we're going to have a practical example. In this case is Mrs. X. Mrs. X did not use family planning for several reasons. The first of which was that the clinic where she had to take her family planning from was far away. And also she did not know how the clinic would benefit to her. Mrs. X has not used family planning and now she has given birth to several children. Giving birth to several children will help reduce her burdensome daily workload and support her in her old age. Her status depended on her marital role since she was not well educated and had few choices in life. So which of the following oral questions could help address Mrs. X's access to family planning services? A, is breastfeeding an effective contraceptive methods? B, how and to what extent do contextual factors influence the use of family planning services? And C, how does a woman's education affect her subsequent use of family planning services? So this is actually a question for us to answer. So please, you can just drop a response in the chat box. Oh, actually, I cannot see. And we have a second scenario where Mrs. X suffered unexpected problems with her pregnancy. She and her family failed to identify the problems as a serious complication requiring immediate medical attention. So which of the following questions could help increase the likelihood that Mrs. X would identify the problem as needing medical attention before it became serious? We have option A, a behavioral change communication programs and effective means of raising awareness of pregnancy complications. B, how many women suffer from serious obstetric complications in Mrs. X home district? And C, how can existing network be harnessed to achieve widespread awareness of pregnancy complications? So please just drop your responses at the in the chat box, and we're going to look at it at the end of the lesson. So after we have formulated IR question, the next important thing we want to do is to come up with IR objective using the SMART. SMART stands for specific, measurable, attainable, reliable, and time bound. So we want to select objectives for implementation research that are SMART, like specific, sorry. So what exactly do we have to do? Who will have to do it, and where will it be done? Those are kind of some of the aspects that you should include when you're drafting your SMART IR objectives. And talking about the measurable aspect of it, can it be quantified? What are some of the clear indicators that will help us to know that our intervention was successful or not? And the attainable aspect is it realistic? Is it something that we are going to be able to do within a given period of time? We should not set an objective that will need us 3 months to implement, and then we are 3 years to implement, and we're expecting to implement it in 3 months. It's not attainable. And also, how are our interventions reliable? So is it, can we actually base on the findings of our intervention to be able to say that, okay, this has been effective, or mosquito treatedness have been effective in malaria prevention? So how much are we going to rely on on the statistics that we get from implementing our intervention? And the most important aspect of it should be time bound. We should be able to set clear deadlines and time frames for our interventions to be implemented. And using SMART objectives enables us to have a picture of what exactly the implementation is going to look like, how exactly the implementation process is going to look like, and also clarifies us on how success is going to be defined at the end of the intervention. It also helps us to be able to monitor and evaluate our intervention process, and it keeps the project on track to make sure that we are doing what we are supposed to do and not going out of our objectives. So my colleague is going to continue on the study designs in implementation research.
Okay, I'll continue from here. Yes, like Jordanne said, implementation research, our focus is to understand and to evaluate how evidence-based interventions are adopted, implemented, and sustained in real-life settings. So before you choose a study design in implementation research, first of all, your choice will be based on your research question, the context, and your desired outcomes. And with that, we are going to start with the hybrid designs, or the hybrid effectiveness implementation designs. These designs are designs that are used to bridge the gap between testing and interventions effectiveness and its implementation. That is, we are looking at, for effectiveness, interventions effectiveness, we're looking at, does it work? And for its implementation, how is it adopted and sustained? And from this, there are 3 types of hybrid designs, and it's distinguished primarily by the focus and the balance between effectiveness and implementation. So for the type 1, the hybrid type 1 design, The focus is to test the effectiveness of the intervention. And the secondary, that's the primary aim, is to determine effectiveness, and the secondary aim is to understand the context for implementation. For example, the sample research questions we have here: will the intervention work in this setting or these patients? And secondary question: what are potential barriers or enablers for wider implementation? So this is a type 1 hybrid design. For type 2 designs, the focus is on both. That you have equally test effectiveness and implementation outcomes with co-primary aims. For example, the co-primary aim is you want to determine effectiveness, and the co-primary aim, you want to determine feasibility and potential usability of implementation intervention/strategy. And an example of a research question here, the research question here is co-primary question: will the intervention work in this setting or these patients? Or does the implementation strategy show promise in facilitating implementation? And we see that together we are looking at effectiveness outcomes. We are testing effectiveness and we are testing implementation in type 2 hybrid designs. Then for type 3 hybrid designs, here the main focus, the primary focus, is to test the implementation strategies, while secondarily you assess the effectiveness outcomes. Okay, so you first of all test implementation strategy, then you collect data on effectiveness outcomes. And the primary research aim is to determine utility of implementation strategy, and the secondary aim is to assess effectiveness outcomes. And the sample research questions here: primary question: which strategy works better in facilitating implementation? And the secondary question: are effectiveness outcomes acceptable? So this is for hybrid designs. Now we look at experimental and quasi-experimental designs. The main difference between experimental and quasi-experimental design is that in the quasi-experimental designs, the subjects are assigned to groups with a non-random method. So you can decide to assign subjects without randomly assigning the subjects. Whereas in experimental design, the subjects are randomly assigned to groups. Quasi-experimental designs are research methods that are used to evaluate interventions or treatment when random assignment to groups is not feasible or is unethical. And unlike experimental design, for example, the randomized control trials, quasi-experimental design, they lack full randomization, but their main aim is still to estimate causal effects by using comparison groups or other strategies to control for confounding variables. So in quasi-experimental design, there is no randomization. And in experimental designs, we have randomization. And the use of control groups is not often mandatory in quasi-experimental design. You can use other factors to control for confounders. Whereas in experimental designs, it requires that you use a control group or treatment groups to control to test the effect of your experiments. Other designs that are also used in implementation research, you have observational and mixed method designs. And for these designs, you have prospective cohort studies where you follow up participants or settings over time to observe your implementation results. Then we also have case study designs where we use in-depth understanding of implementation in specific settings. And these are usually useful for exploring context and mechanisms. Then lastly, we have the mixed method designs. This one, it combines both quantitative and qualitative methods to assess our implementation results. And these observational and mixed method designs often are used in implementation research to explain not just what happened, but why. Lastly, we have the qualitative designs. By qualitative, we use in-depth interviews, focus group discussions, and ethnography to help us understand the barriers and facilitators, to understand stakeholders' perspectives and contextual influences on our implementation. And they are very essential for adapting and tailoring our interventions, because you may want to understand why the perspective of stakeholders in a study where you want to conduct in a community before you go ahead to implement that study. Because if you don't do that, if you don't understand, you will not be able to better adapt or tailor your interventions based on the barriers that you identified in that community. We're also going to talk about ethics in implementation research. Ethics is defined as norms that we use to conduct research, and these are conducts that are usually classified as acceptable and unacceptable behavior. You have there are standards of a particular profession, occupation, institution, or group within society. That is, we have medical ethics, we have business ethics, and we have research ethics. And ethics is a discipline that employs methods and logic to answer the question of how one ought to behave. So there are principles that you ought to use when carrying out implementation research. First of all, you have to be aware of the moral dimensions of practice. What do we mean by this? What is morally right or wrong? What is good or bad? What is permissible or not permissible? What is acceptable or problematic in relation to human actions or behavior? Then also you have to it involves making choices and justifying the choices that we make. Sometimes it is not black and white. There are certain conflicts that may present itself, or certain ethical dilemmas, but there are norms that talk about how you ought to behave when conducting research. So first of all, there is respect for persons. You have to acknowledge that individuals are autonomous, and you protect their diminished autonomy. Then there are individuals that have diminished autonomies, that are vulnerable populations that you ought to protect. Then for beneficence, aim to do good, maximize possible benefits and minimize possible harms. You balance the risk and the benefits. If you're conducting an intervention and you know that there are risks, try as much as possible to reduce the risk to the participants. And if there are benefits, let the benefits be distributed equally and in all fairness. Then justice, fairness in the distribution of benefits and burdens. Fair subject selection. For example, if you want to conduct an interview and you know that at the time you are conducting that interview, maybe those participants are supposed to be at work, you are taking some time off their work. It's fair, it's justice for you to be able to compensate them for the time that you take off their work. So these principles provide a framework for analysis and an aid in the resolution of ethical problems. And there are three main phases in implementation research and ethics. You have three methods. In the planning phase, there are some ethical principles that you ought to respect, implementation phase, and the post-research phase. In the planning phase, responsiveness to local needs and priorities, the people's study design, stakeholder and community engagement, balance between risks and benefits. Stakeholder and community involvement. You cannot go to a community, you want to carry out a study, you don't involve the stakeholders, you don't engage the community, you don't, all of this, you have to look into this. It's unethical for you to approach your research participants without involving the stakeholders in the community, without meeting maybe the quarter head, those that are considered as heads of that community. Maybe they may question what you are doing. At the implementation phase, autonomy and informed consent. Let the people know what they are doing. Give them the right to accept to be part of that study without you influencing or coercing them to take part in your study. Ensure that their privacy and confidentiality is met. The standard of care should be there, and community and health system empowerment, empower the community, empower the health systems. Don't come and meet a problem and you know that you can solve that problem or you can address the problem, and you leave that community on that health system without solving the problem when you have the solution. And for the post-research phase, destination of research findings, you cannot come to a community or a population, you carry out a study and you have findings, and the people that took part in your study are not aware of your findings. It's unethical. You have to disseminate the result. You have to plan and know how you intend to disseminate these results to this community. Then the data ownership, translating your findings into public health action. So don't just collect data and you keep it. Be able to share. The findings should have an impact. There should be something new you're bringing into that community and the population in which you conducted your study. So scaling up implementation research, we use the correct criteria. What does it mean to scale up? These are deliberate efforts we use to increase the impact of successfully tested health interventions to benefit more people and to foster policy and program development on a lasting basis. So using the correct criteria, first of all, is it credible? Based on it should be based on sound evidence or advocated by respected persons or institutions. Observable, to ensure that potential users can see the results in practice. Relevant, for addressing persistent or sharply felt problems. So your research should be relevant. You should address problems that have been identified in the community. Then relative advantage. What is the advantage over existing practices so that the potential users are convinced that the benefits counteract the cost of implementation? You're coming up with a new strategy of doing things. What is the relative advantage of what you're bringing in compared to the methods that they have been using? There should be existing benefits that the users will see, and they'll be convinced that what you're bringing in is better than what they had before. So easy to install and understand. It should not be complex and complicated. It should be compatible with potential users' established values, that it fits into larger programs and contexts. And lastly, it should be testable without permitting potential users to complete adoption before results are seen. So they should be able to test your research and see that, okay, what we are putting ourselves into, what we are doing is actually going to benefit us. So what are some of the constraints in implementation research scaling up? The first thing is funding. Implementation research can be quite expensive. And also stakeholder access to information at different levels. Different stakeholders, they may not have the information, they may not be informed about what you're doing, so it may hinder the study you want to carry out. Lack of political support. There are some studies that you may want to conduct, and if there are some administrative or political bottlenecks, you may not be able to carry out that study. And the frequent changes in staff or policies at any level. This is a serious problem, because if you're conducting a study and there are different changes in staff, for example, in the institutions we have, you can be carrying out a study with medical doctors or nurses. You train them. By the time you're coming to follow up, the people that you have trained have been transferred or they have gone to other units, and it affects your work. The lack of skilled facilitators is another problem. Then lastly, influence and relationship of different contextual level, that's at the individual, organizational, community, and the policy levels. So these are some of the constraints that you can have when you intend to scale up your implementation research. So in conclusion, framing effective and appropriate implementation research questions is key to high quality implementation research. Also, implementation research can provide valuable information that may be used to improve services and programs, which in turn lead to improved health outcomes. Lastly, in implementation research, we use a broad range of study designs, most often mixed methods and hybrid trial designs. And These designs are usually based on your research questions, your context, and your desired outcome. So these are some of the references that we used. Thank you.